Hello friends, I am Dr.Jothydev Kesav, a diabetologist working in Kerala. Has COVID-19 affected us? Obviously it has affected all of us. It has adversely affected our patients, it has adversely affected our practice, and during the last more than 14 days, we have been continuously answering to the telephone calls, to the messages, to the WhatsApp messages. As doctors, we have been trained to solve the problems. So we are supposed to counsel our patients, and that is what we are doing. We have a team already existing in our hospitals. We have a 24 hours helpline, and we have a diabetes telemedicine system. And during this disaster, we find this extremely useful for our patients. The major reason for the telephone calls were anxiety. So they were anxious about diabetes patients getting COVID infection and the chances of hospitalizations and more chances of death. And then the question was on unavailability of medications. And this has been a very major concern. So some of them, especially the educated ones, they were asking us on if the lockdown is getting extended for another 1 month or another 2 months, what will happen? Will I be able to procure the medications? Will there be any shortage of medications? This is because all these medications have to come from other parts of India, from other parts of the world. So obviously when there is no transportation available, so these are all difficult times. These are difficult times when we require the doctor himself to be answering the questions, and we have to have the counselors, we have to train the nurses accordingly. And then the patients had the question on doing the laboratory investigations to meet the doctor. So we were not encouraging direct visits, we were encouraging only the telemedicine visits. So our Keshavdev Trust is supporting hundreds of children, hundreds of elderly patients, orphaned elderly, those who are economically challenged. And for these patients, we are still providing during this disaster medications and treatments free of cost. So I would say that the solution during this disaster will be telemedicine. If you go by the definition of telemedicine, the original definition, it is providing medical services via telecommunication devices, the simplest being a telephone. So the patients require only a telephone with them. If it is an ordinary telephone, it can be a telephone call. If they have WhatsApp or Facebook, or if they have a Skype, it can be an advanced video call. And if you have your own app or a telemedicine system which is running in your hospital, then you can have your medical records and you can go back to the previous history, and you can have projections based on the previous values, so that even dosage modifications can be carried on. So in this disaster, during this COVID times, I believe that treating diabetes and managing our patients with diabetes to help them control their blood sugars, to motivate them on physical activity, on getting adequate rest and sleep is still possible, and we need to make use of our telecommunication devices to keep in touch with the patients, because patients are very important for us, and this is one of the toughest times for our patients and for us. We need to overcome, and we will overcome